Hi, I'm Dr. Chandler. Welcome to this overview of psychological disorders. I encourage you to print the notes provided for you and to take your own notes. Let's begin. The Diagnostic and Statistical Manual of Psychological Disorders was established in 1952 and is now in its 5th edition. The DSM identifies symptoms for the diagnosis of psychological disorders. It does not list or describe methods of treatment for disorders. Examples of changes in the Diagnostic and Statistical Manual over the years include symptoms of returning soldiers, once referred to as battle fatigue or shell shock, while the current Diagnostic and Statistical Manual discusses these symptoms in terms of the diagnosis of post-traumatic stress disorder or PTSD. Less than 50 years ago, an individual could be imprisoned indefinitely in a mental hospital for homosexuality. Today, this previously diagnosed psychological disorder is thought by some to be a lifestyle choice. However, evidence is emerging that homosexuality is determined by genetic predispositions interacting with levels of stress hormones experienced by an unborn baby. The presence of normal versus abnormal behaviors are often used to define disorders. However, what is not normal can sometimes be difficult to delineate. This is especially true given stereotypes and myths about mental illness, such as that all psychological disorders are incurable, and that those with disorders are visibly weird. Some of them are, but some normal people are visibly weird as well. Just as apparently normal people can sometimes be dangerous and violent, although those suffering a psychological disorder do not often have the psychic energy to make a plan and carry it through to intentionally harm another person. The criteria of abnormal varies across time and cultures. Deviance is norm referenced and based upon averages and variance. Abnormal is also determined by what is considered maladaptive behavior, such as behavior that causes harm or injury to the person with the disorder or others. A psychological disorder also includes personal distress, pain, and enduring psychological suffering and discomfort. Again, what is considered abnormal or normal is culture-bound. Relative to the cultural framework, the experience of thoughts and actions that are deemed acceptable or unacceptable in a specific culture and subculture. The American Psychiatric Association considers a psychological disorder to involve significant pain or distress with the ability to work or play. Increased risk of death or loss of freedom in important areas of life are also evident, as is that the source of the disorder must be within the person due to biological factors, learned habits, or mental processes, not a normal response to specific events, such as the death of a loved one. Psychological disorders are not determined by social conditions such as poverty, prejudice, government policy, or other conflicts with society. Although these environmental stressors, such as living in a war-torn area, are thought to increase rates of psychological disorders, especially for those with a genetic predisposition. Varying levels of productivity in work and relationships are natural. However, when a person suffers a psychological disorder, he or she may be able to function, but at lower levels, just like you would when you have the flu. Most psychological disorders today are thought to vary along a continuum from healthy to suffering specific symptoms of a disorder that would impact your functioning. While the Diagnostic and Statistical Manual 5 still lists separate disorders, the new manual incorporates dimensional methods of severity for many disorders. This shift is based on the realization that the lines between many disorder categories blur over the lifespan, and that symptoms attributed to a single disorder may also appear in other disorders, just with different levels of severity. This approach means thinking about what disorders have in common instead of what makes each different. Here is one of the diagrams that you will be asked to draw and explain. This is a diagram that indicates neurotic disorders because the individual feels vulnerable and has difficulty coping with the problems they encounter on a daily basis. The world appears overwhelming to individuals suffering neurotic kinds of disorders, and their problems seem insurmountable. The person feels weak and unable to cope with daily life when suffering these kinds of disorders. The difference between occasionally experiencing these feelings and being diagnosed with a neurotic kind of psychological disorder depends upon how long an individual feels like he or she cannot cope, and the specific symptoms that will be discussed related to these disorders. Often an individual with a neurotic kind of disorder can function, but at a lower level, due to the extreme emotional pain that they are experiencing. These disorders are described as being comparatively mild because they are more treatable than the other categories of psychological disorders that we will review. These disorders are the most common kinds of psychological disorders. In fact, mood and anxiety disorders are sometimes called the common cold of psychological disorders. Fortunately, some of these disorders are curable or may diminish over time with or without psychological treatment. Dissociative disorders are often confused with psychotic kinds of disorders where a person is out of touch with reality. However, dissociative and somatoform disorders are not usually psychotic or out of touch with reality. Again, comparatively mild means that those who suffer these disorders experience a high degree of pain. However, compared to schizophrenia or character disorders, these neurotic kinds of disorders are treatable, sometimes curable, and not as damaging to relationships as are psychotic and character disorders. In this diagram, we see the split from reality that is often confused with split personality. These two descriptors are very different. An individual who suffers psychosis or schizophrenia cannot sort out accurately what stimuli is from the external world and what stimuli is from the internal world. We see these boundary problems in this diagram, showing a confused orientation to the world that most often leaves the individual unable to function normally in work or their relationships. Psychotic or schizophrenic disorders literally mean split mind with fragmented thoughts and emotional disturbances, really a split or break from reality. General symptoms such as trouble holding a job, irrational thought, deterioration of personality, and deterioration of adaptive behavior. With distorted perception, disturbed emotion, social withdrawal, a disturbed sense of self, poverty of speech, and abnormal motor behavior. To be diagnosed with a character or personality disorder, one must have inflexible and enduring behavior problems that impair social functioning. We all start out as children with these patterns, such as not taking the needs of others into account before we act. As we mature, we learn to consider the consequences of our actions in an attempt not to cause hurt to others, because we have the ability to empathize or feel pain when we see others suffer. This diagram indicates that someone with a character disorder views the world as small and insignificant. In this orientation, the self is everything, while the goals, interests, or rights of others are unimportant. An individual with this orientation can cause a great deal of harm to others, while those with neurotic disorders struggle to get through the day with their emotional pain, and those with psychotic disorders are irrational and out of touch with reality. This usually alerts others that they are not experiencing the same reality. Meanwhile, those with character disorders are often unable to experience empathy for the pain of others, and they experience such low anxiety that they seek out risk to relieve their empty state. They may look and act normal, but they are wolves in sheep's clothing. Other common types of psychological disorders include the catch-all of adjustment disorder. This is a lack of harmony with one's environment involving the inability to satisfy most of one's needs, such as the physical and social demands of life, and this is usually temporary. There's also substance abuse, as we discovered in Altered States of Consciousness. Substance abuse consists of several kinds of problems: dependency, the psychological need for a drug despite knowing results when one stops administering the drug; addiction, when an individual cannot stop using the drug even with extreme physiological discomfort and distress. Also withdrawal, that's when one stops taking a drug, such as drinking alcohol to reduce anxiety, to go to sleep at night, but they wake up during the night experiencing the opposite of the alcohol's desired effects. In fact, they feel very anxious and have shaking hands and heart palpitations. Commonly, individuals may suffer dual diagnosis. This includes a combination of types of disorders, generally a neurotic disorder and a substance abuse. With dual diagnosis, it is important to find the underlying problem to treat first: the psychological disorder such as depression, or the substance abuse such as alcohol dependence. Which came first? The second disorder is generally caused by the first disorder and cannot be successfully treated until the first disorder is successfully treated. Results of a National Institute of Mental Health study by U of M Institute for Social Research on rates of psychological disorders indicate that nearly half of people ages 15 to 54 have experienced at least one bout with a psychiatric disorder. About 1 in 3 have had such an episode in the last year. Rates of experiencing a psychological disorder peaks between the ages of 25 and 34. Affluent, well-educated people seem to suffer less anxiety than others, perhaps because they're not as scared about their future and they can afford to buy psychological help. Despite the high lifetime rates of emotional problems, only 1 out of 4 people have ever received help. Some psychological disorders are mild and people recover from them, fortunately, without help. This study found the most common disorders to be major depressive episode, with at least 2 weeks of symptoms such as low mood and loss of pleasure. More than 17% of individuals have suffered an episode in their lives, many of these in the past year. The U of M study found additional common disorders are alcohol dependence, with more than 14% experiencing this in their lifetime. According to your text, over 18% experience an anxiety disorder in a given year, and 13% experience social phobia in their lifetime, which is a persistent fear of feeling scrutinized or embarrassed in social situations. While 11% experience simple phobia in their lifetime, a persistent fear of objects such as animals, insects, or blood, or of situations such as cold, closed spaces, heights, or air travel. Given the 3 categories of psych disorders that I reviewed, neurotic, psychotic, and character, which category would you place social phobia? Additional sources for information that you can check are the National Institute of Mental Health. And here's a TED Talk you can look up that will review mental disorders as brain disorders.